Hi, this is Dr. Saxena, and me talking on some things called. This is it's a slightly contentious issue, and we talk about what are the laws and all that. And this is regarding we are trying to work with this media, particularly with this channel. We try to make the patients aware what is they are up to. This is trying to empower them with the knowledge, and yes, they also should read what are the things which are happening at first hand. This one want to tell you about how things are getting unfolded with this present COVID-19 situation. It was in 26 February 2019. The Association of American Physicians and Surgeons, the association called AAPS, strongly opposes the federal interference in medical decisions, including mandated vaccines. So, what I believe is the vaccination is a procedure, as a surgery is a procedure, as a aspiration is a procedure, as a giving a kind of thing, and consent is very important here. So, after being fully informed of the risks and the benefits of a medical procedure, patients have the right to reject or to accept that procedure. So, I somewhere believe I had seen over the years what is happening is this thing is thumbed on the people. You're not asking a newborn whether he would like to go for a injection or not. Neither the parents are being asked. This we believe that it's a kind of you need to have this kind of thing, openness, and the patients have the right to reject or accept the procedure. So the regulation, this is how governmental, there are a lot of things as such, and it is ultimately it should be the patient as well as the these kith and kin who should, or the parents should decide what about accepting the drugs or any other medical intervention which can be so it is not this particular thing a public health threat is the rationale for the policy on mandatory vaccines. I don't think it should be mandatory at all. But how much of a threat is required to justify forcing people to accept the government imposed risks? This has to be worked out. We have seen regulators may intervene to protect public interest in 1 million risk of a threat, such as cancer from an involuntary exposure to toxin, or 1 in 1 lakh risk from voluntary occupational exposure. So, what is the risk of the death? What is the risk of cancer? Or what is the risk of crippling complication for a vaccine? So, we need to weigh that pros and cons. So, presently there is no rigorous safety studies for sufficient power. No rigorous safety studies of sufficient power to rule out a much higher risk of complication, even 1 in 10,000 for vaccines. Such studies should require an adequate number of subjects, a long duration, years, not the days, an unvaccinated control group, which is an arm, and which placebo should be given, which placebo should be very inactive, such as saline, not the adjuvant or everything but the intended antigen, and consideration of all adverse health effects, including neurodevelopmental disorders, over a period of. What happens is that there is an onset of the neurodevelopmental disorders. They start after 3 years of the onset of vaccination. So this also has to be considered. All the vaccines are being approved after a day, after 3 days or 5 days. Looking at that, now also we just watch the patient for half an hour after giving the vaccine and say, okay, nothing is happening, can go. This is an acute reaction. What you are looking for, the acute reaction. Acute reaction is something like anaphylaxis or something like that. If God forbid, if you get that, you can always be at a center and you can. So we are talking about not this acute, but long-term complications also. We need to follow that particular things. Um, See, I can always tell you this is vaccine is necessarily risky, and as recognized by the U.S. Supreme Court and the Congress. The vaccine injury compensation program has paid about not almost $4 billion in damages, and the high hurdles must be surmounted to collect the compensation. The damage may be so devastating that most people would prefer restore function to multi-million dollar damage award. See, just give you the magnitude because this most of the things are not reported from this side of the world, and it is being taken as a is given as a yes, it's a holy cow. Vaccine is a holy cow. No, nothing wrong with that. But this when so much things have been reported from the other side of the globe, why this particular thing is not applicable here? I'll give you a simplest example how these vaccines are. You take away kind of like vaccine called smallpox. Smallpox vaccine is so dangerous that you can't get it now, despite the weaponization of smallpox. You cannot get the smallpox vaccine now. Rabies vaccine, again a danger, a particular problem with that. Rabies vaccine is given only after a suspected exposure or high risk persons such as veterinarians. Only to people who are exposed to this one, rabies vaccine is given. The whole pertussis vaccine, the DPT, which was before it was a cellular pertussis vaccine, was withdrawn from the US market, and I think it was around 1986, and it was replaced by acellular pertussis. But the other cellular pertussis is still being rampantly used in other parts of the world. So we need to understand what is the risk-benefit ratio, because it varies with the frequency and severity of the disease. It varies with the vaccine safety and the individual patient factors. This must be evaluated by patient and physician, should not be imposed by a government agency. Somewhere we had got that kind of mandates before. Measles was a much publicized threat, and which there was the publicity was so enormous that it ultimately led to push for the mandates, and so it's a worse threat among the vaccine preventable illness because it's so highly contagious. Occasional outbreaks, generally starting with an infected individual coming from somewhere outside the US, there were some occasional outbreaks. It so happened in this part also. The majority, but not all, by no means all the people who catch the measles have not been vaccinated. I have instances where vaccines were given, measles vaccine was given, and still they got into something called measles infection. So almost all of them make a full recovery. If a person has got a normal measles infection, they almost make a full recovery with a robust lifelong immunity. We have not seen deaths of measles for the last 4 or 5 years now. It has to be looked into risk versus benefit ratio. What are the risks here? If you want to rampantly, you need to vaccinate all the people. What are the things which we are getting into it? People are getting into serious complications following measles, MMR, and even it is listed in the manufacturer's package list, though a casual relationship may not have been proved. See, so this all the things which we make What happens is that you have got a mandate, government mandates for particular thing, asserts a need for 95% of immunization rate to achieve herd immunity. So, because of the complete herd immunity and measles eradication are, this is a thing which cannot be, because of the herd immunity, measles eradication are unachievable. Better goal is for herd effect and disease control. Better outcome would result, they argue, from informed consent, more open communication, and market based approaches. You had seen, disregarding adverse vaccine effects, the results of near universal vaccination has not been completely positive. Measles, when it does occur, is 4 to 5 times worse than pre-vaccination times. Because of the changed age distribution, more adults, more those vaccine-based immunity wane, and for more infants who no longer receive passive immunity from their naturally immune mother to protect them from their vulnerable years. So we felt there was a reason this kind of thing, which is, as a responsible physician working in environmental medicine, I believe that liberty rights are unalienable. Patients and parents have the right to refuse vaccination. Although potentially contagious persons can be restricted in their movements, as it happened with Ebola, it can happen with this present pandemic also, as needed to protect others against the clear and present danger. Unvaccinated persons with no exposure to disease and no evidence of a disease are not a clear or present danger. So, as a group of integrative medicine physicians, we believe this mandating of vaccine, compulsory kind of to be vaxxed, is has to stop. We strongly oppose this interference, federal interference in medical decisions, including this mandated vaccine. After fully informed of the risk and benefits of medical procedure, which can be vaccine administration also, patients have the right to reject or accept that procedure. This has to be honored, and this we strongly we believe this thing should also apply here, as is being done in the other parts of the world. Thank you.